Cameroon is really happy to share this WHO resolution on imaging. You know that our Honorable Minister of Health, His Excellency Dr. Manauda Malashi, has signed this document because he has the great view, he has the leadership to manage infectious diseases and non-communicable diseases in our country and among Africa, as the third Vice President of the Council, member of WHO. You know that cancer imaging is really on board for our patient, and we need this resolution to create policies and standards to invest in imaging equipment and to train healthcare professionals, to include imaging in insurance and country device, why not in universal health coverage, and also need assessment in and instrument cases for imaging. We need to invest in new technologies that are easier and sustainable to use, and to employ safety standards, and to adapt procedure best practices to local contexts and utilize telehealth where appropriate. Our request to WHO is to provide assistance to member states to continuously update devices, to provide guidance on quality improvement, and promote cost-effective imaging, evaluate new technology, identify emerging technology, and support education, and also collect data and availability functionally for red imaging equipment. All this will really need help patient for early diagnosis, for diagnosis, and even for the follow-up of the treatment. Maybe for non-communicable diseases like cancer, we really need this WHO resolution, and Cameroon, through His Excellencies, our Honorable Minister of Health, is really happy to be on board as leadership for this WHO, for this World Health Assembly resolution. Thank you very much.
Hello, I'm Jennifer Dent, the President and CEO of BioVentures for Global Health. I'm honored to express our strong support for the World Health Assembly resolution on strengthening medical imaging capacity. This important resolution, led and championed through the leadership of Cameroon, calls for coordinated efforts to improve access to imaging services. The resolution highlights gaps in imaging infrastructure and workforce numbers and skills in low and middle income countries, and it outlines clear recommendations, including building sustainable imaging systems, investing in training healthcare professionals, and fostering international collaboration. Through BVGH's African Access Initiative, our team works with governments across Africa to expand access to prioritized cancer medicines and technologies. Medical imaging is an essential component of cancer care. It is critical for the detection, the diagnosis, staging, and monitoring of disease. In 2022 alone, there were over 20 million new cancer cases globally, with nearly 760,000 cancer deaths. Africa reported 1.2 million of these cases, and we can all imagine how many cases were never detected and how many patients went without care. Without strengthened imaging capacity, patient outcomes will not improve in low-resource regions. We commend Cameroon for its vision, and we ask all member states to support this resolution. Together, we can close the imaging gap and strengthen healthcare systems for all patients.
Je suis professeur Innocent, directeur coordinateur du Programme national de lutte contre le cancer et chef du service du cancer du CHU de Treichville. La Côte d'Ivoire fait partie des pays où l'intérêt du diagnostic par l'imagerie occupe une place très importante. Il faut dire que ce cancer est un problème de santé publique dans notre pays. Selon le WHA 2022, on a estimé à plus de 20 000 nouveaux cas avec près de 14 000 décès. Nous savons que l'imagerie joue un rôle important dans le diagnostic précoce pour pouvoir faire ensuite une stratification par les scanners ou bien l'IRM. La Côte d'Ivoire dispose de ces moyens de diagnostic et l'obstacle reste celui de la sensibilisation aux populations pour pouvoir consulter les centres d'imagerie afin d'avoir un diagnostic le plus exhaustif possible. C'est pourquoi la Côte d'Ivoire investit des partenariats avec d'autres sociétés pour améliorer son plateau technique en termes d'imagerie. Cependant, le besoin reste grand parce que, mis à part les deux grandes villes du pays, on observe un désert au niveau des outils diagnostiques tels que le scanner et l'IRM. Nous appelons aussi donc à l'adoption de la résolution de l'Assemblée mondiale de la santé sur le renforcement de la capacité d'imagerie médicale et invitons tous les États membres à se joindre à nous pour promouvoir l'accès à une imagerie de qualité pour tous.
Hello, everyone. I'm Dr. Hedwig Risak. I'm a board-certified radiologist with a lifelong commitment to transforming cancer care through medical imaging. In 2021, I had the privilege of chairing the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine. Our goals were clear. We wanted to highlight the indispensable role of imaging in cancer care, but to quantify the tremendous global inequities and estimate the impact of increase in access to imaging. The Commission findings are clear. Without access to medical imaging, there is no early detection, accurate diagnosis, evidence-based treatment or treatment follow-up. In short, there is no modern cancer care. Currently, 3.6 billion people lack adequate access to diagnostic imaging. This results in late-stage diagnosis and preventable death. However, we can change this by scaling up imaging infrastructure and services in undeserved regions. We can avert an estimated 2.5 million cancer deaths annually by 2030. These are not just statistics. They represent lives that we can save. Furthermore, for every dollar invested in scaling imaging access in Africa, we anticipate a $21 return. This creates a powerful engine for health and prosperity. This is not only a health imperative, but also an economic and moral one. Imaging requires more than just machines. It demands trained professionals, quality standards, integrated system, and sustainable financing. It is about prioritizing patients, shifting from fragmented, technology-driven solutions to holistic, system-integrated care. The Commission's work underscores the importance of the World Health Assembly resolution on strengthening medical imaging capacity. I urge you to support this resolution. We must translate evidence into action and ensure that imaging is no longer a luxury for the few, but a right for all. Let us close the diagnostic gap. Let us act boldly, invest wisely, and commit fully to saving lives, strengthening healthcare systems, and bringing equity to cancer care worldwide. Thank you very much.
My name is Dr. Zainab Shinkafi Bagudu, and I trained as a pediatrician. As a young consultant working in Nigeria, I was challenged by the dearth of diagnostic solutions that is available for patients. The gap was even more pronounced when trying to make a cancer diagnosis. For this reason and other sociocultural barriers, 70 to 80% of cancer patients in sub-Saharan Africa present with late-stage disease. This is the major reason for the high mortality rates in the region. This spurred us to set up a diagnostic center, which has steadily grown over the last 20 years, albeit with some challenges. However, there have been many advancements in medical imaging that gives us the ability to change this late diagnosis, high mortality rate narrative in the landscape on the continent. But challenges that remain include lack of adequate number and expertise of human resources, financial backing, and accessibility, especially for those people that live in the hard-to-reach areas as well as areas of conflict. Early detection using medical imaging can dramatically change the mortality rates in the common cancers of breast, cervical, colorectal, and lung, amongst others. For breast cancer, mammography can detect cancer earlier, whilst low-dose CT scans are effective in detecting lung cancer in high-risk individuals, enabling earlier treatment options and better survival chances. Colonoscopy use in colorectal cancer detects precancerous growths and also helps us to remove them before it develops into cancer. Colposcopy, along with pap smears, picks abnormal cervical cells which can be treated before developing into cervical cancer. As an advocate and the president-elect of the Union for International Cancer Control, I am actively engaging government, civil society, organizations, development partners, and equipment manufacturers to increase access to medical imaging in sub-Saharan Africa and other LMICs. Therefore, investment in screening technologies is crucial, but it must go hand in hand with policies and programs that raise the awareness in our communities about the importance of screening. Public education campaigns, training for healthcare professionals, and government policies that promote cancer awareness are critical. We must continue to push for the adoption of universal health coverage so that everyone, including the poorest people in underserved communities, have access to advanced medical imaging technologies that exist today. Medical imaging plays an essential role in early cancer detection. Together with effective policies and awareness campaigns, we can significantly improve cancer outcomes in sub-Saharan Africa.
I'm Dr. Julie Graylow, Chief Medical Officer at the American Society of Clinical Oncology, or ASCO. I'm here to provide ASCO's support for the World Health Assembly resolution on strengthening medical imaging capacity and speak to the critical importance of the role of medical imaging in cancer. Globally, investments in cancer treatment are far outpacing investments in medical imaging. Medical imaging is a critical component in the early detection of cancer through screening, in the accurate diagnosis of cancer, and in staging where we determine the location and the spread of cancer. Optimal cancer treatments rely on precision medical imaging in guiding treatment recommendations, evaluating response to treatment, and monitoring for recurrence. On behalf of ASCO, I urge member states to promote access to quality, safe, affordable, and cost-effective medical imaging through sustainable investments in imaging equipment and infrastructure, and a commitment to education and training of the health workforce involved in medical imaging. Thank you for your consideration.
My name is Tolulope Adewale, the MD and CEO of the NSIA Advanced Medical Services Limited, MedServ. The Nigerian Sovereign Investment Authority, through MedServ, welcomes and strongly supports the World Health Assembly resolution on strengthening medical imaging globally. We recognize the importance of this to global health, and we commend the collective will to ensure that populations everywhere across the world and no one is left behind to access high quality and life-saving care, even through medical imaging. In Nigeria, the NSIA through MedServ has made tremendous investment in this area, starting from a state-of-the-art cancer center, which is the NSIA Lute Cancer Center in 2019, where we had put up 3 linear accelerators, and also in NSIA Kano Diagnostic Center, which is in Kano in the northern part of Nigeria, and NSIA Umaya Diagnostic Center, which is in the eastern part of Nigeria, fully equipped with state-of-the-art and modern medical imaging equipment. And because of the success of these 3 centers, not only in the patient numbers that have been seen, but in making early diagnosis, the NSIA has decided to improve and to scale. And to this effect, over the next couple of months, we help to go live in about 10 new diagnostic centers across the length and breadth of Nigeria, and also open another 3 cancer centers in the immediate, and another 3 over the next 1 year, making a total of 7 new cancer centers. And come 2027, we hope to be able to go live with a cyclotron, PET-CT, and SPECT in the country. And high quality diagnosis is critical and indispensable to ensuring oncology care. Not only oncology care, but even every other aspect of non-communicable diseases, even looking at cardiology and the heart. And to this impact, we put ourselves and we say we support very strongly, and we hope that this resolution is passed and that we can encourage others to also adopt and increase access to advanced medical technologies globally, so that no part of the world is left behind. Thank you.
Hello, I'm Mark Stays, President of Enterprise Solutions and Partnerships for GE Healthcare International Markets. The current resolution for medical imaging in low-middle income countries is key in importance for not only our markets, but also for GE Healthcare. Our focus on addressing the needs of these markets, specifically in non-communicable disease, where we see $1 spent equivalent to $21 improvement in quality of life, is not an option, but a requirement for us to support. With that support, we're looking at how we can deliver safer, higher quality of access to remote areas, as well as advanced technologies to allow us to improve the quality of training and education for those individuals in the healthcare industry, as well as developing the next level of solutions in AI to allow us to treat more patients in an efficient and effective way. We look forward to partnering with both public and private entities to allow us to address these needs in a safe and effective manner. Thank you.
In Ghana and globally, medical imaging plays a vital role in advancing women's health by enabling screening, early detection, and diagnosis. Mammogram is a powerful tool for the early detection of breast cancer, often identifying tumors before they can be felt and when they are more easily treatable. It's also through imaging that we are able to stage most cancers. Colposcopy for cervical cancer screening allows for close examination and early treatment of abnormal cells, significantly reducing the chances of late-stage disease. For pregnant women, ultrasound is a cornerstone tool, confirming pregnancy, tracking fetal growth, determining position, and ensuring both mother and baby are progressing well. It also helps identify complications or abnormalities. These imaging technologies empower prevention, save lives, and ensure women receive the health support they deserve at every stage of life. My name is Dr. Beatrice Yafe Adai. Thank you.
My name is Dr. Mputwe. I am an oncologist in the country, Lesotho. In the past, Lesotho has had cancer burden not as pronounced as now. That says Lesotho isn't very ready to stage its people. We have, for the longest time, been sending these patients to neighboring countries where we treat these patients. We are of the understanding that there is need to build capacity in country in terms of imaging. I am here today to support the World Health Assembly resolution on strengthening capacity on imaging in country. I am for this resolution because, as we may all understand, patients having to travel to different countries for imaging before they get their treatment get strained in terms of language barrier, increased costs. We would like to support that all countries, mainly in the low resource countries, mainly, which is where we see these challenges, that we work towards independence in terms of building imaging capacity in country. In most cases, you find patients need to travel not only for those advanced tests like PET-CT, which majority of the patients would be needing to have. In my country, basic tests like MRI, we still don't have that functional. I would like to urge all countries, all leaders present in the World Health Assembly today that we focus and look at the needs for the countries. Cancer is a growing burden. We need not wait until it is too late. We know that we treat what has been tested. We treat what has been staged, and the treatment in oncology is dependent on the stage of disease. And the staging is done through imaging. And it is for this reason that I stand here to say, let us have this capacity at home. It is very relaxing for many patients to be treated at home, where they can speak their language, where they can go for a test and still go back home to see their family. Unlike in cases where patients will stay over away from home for longer times that are indeed unnecessary. Thank you very much.
According to WHO, in Senegal, non-communicable diseases are now responsible for 53% of all deaths. This includes cancer, cardiovascular disease, diabetes, and chronic respiratory illness, conditions that require early and accurate diagnostics to be managed effectively. Medical imaging is a cornerstone in the fight against this disease. It enables early detective support, accurate diagnostic, health monitoring treatment, and reduce the need of unnecessary invasive procedures. Imaging also plays a critical role in maternal and child health, trauma care, and infectious disease management. To achieve our national health goals and progress towards universal health coverage, we must invest to equitable access to safe, high-quality, and affordable imaging services. I strongly support the World Health Assembly resolutions on strengthening medical imaging and call all on partners to prioritize this vital area for the health and well-being for our populations.
Medical imaging plays a vital role in the diagnosis and management of communicable diseases and non-communicable diseases. For cancer patients, more than half of whom will require radiotherapy, medical imaging helps define their tumor size, location, and guide treatment to protect healthy tissues. Medical imaging is also used to monitor tumor response and progress after treatment. Advances in the field are enabling innovations like adaptive radiotherapy and personalized treatments and improved tumor targeting. As the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine showed, scaling up access to imaging alone can avert about 2.5 million cancer deaths. And this would yield productivity gains of more than $1 trillion between 2020 and 2030. Scaling up imaging, treatment, and care and quality could grow these figures to about 9.6 million lives saved and more than $2.5 trillion gained, all for an investment of $2 billion. As countries around the world expand their radiotherapy capabilities, including through the IAEA's Rays of Hope initiative, investments in imaging technologies and training will be critical to ensure the safe and effective use of these radiotherapy services. Thank you very much.
In Kenya, medical imaging is not a luxury, it is a lifeline. It can mean the difference between life and death. On behalf of Kenya's Ministry of Health National Cancer Control Program, I urge support for the proposed World Health Assembly resolution on strengthening medical imaging capacity. Cancer is a leading cause of death in Kenya and a major public health concern, with around 45,000 new cases and 29,000 deaths reported every year. Tragically, over 70% of these cases are diagnosed at late stages, often because early diagnostic services like imaging are not accessible or adequately distributed. To address this, the government of Kenya has implemented various initiatives, including public-private partnerships that have significantly expanded access to imaging equipment such as CT scans, MRI machines, and mammography units across all 47 counties. These technologies are essential for early detection of cancer. They're also essential for accurate staging and radiotherapy planning, ensuring that patients receive the right care at the right time. But despite this progress, challenges remain. Equitable access to imaging is essential to achieving universal health coverage. I strongly urge the swift adoption of this resolution. It presents a shared global commitment to close the diagnostic gap for Kenya and for every country fighting to save lives through timely and accurate diagnosis. Thank you.